Hi, all. My name is Chelsea Irby, and along with my group members, Amanda Casapava, Robert Flanagan, Gwandala Johnson, Faye Ned, and Kayla Stanley, we present our final project presentation on health literacy. We hope that this presentation relays the importance of health literacy's application in clinical care, factors that affect health literacy, and the effect of health literacy on potential patients. We hope you enjoy. Before advancing to explanations on health literacy causations, health literacy ought to be defined. Before advancing to explanations on health literacy causations, health literacy ought to be defined. Health literacy is defined as personal characteristics and social resources needed for people to access, understand, and use information to make decisions about health. On the next slide, a healthcare practitioner will discuss the impactful nature of healthcare literacy.
Health literacy is an individual's ability to understand and utilize various health services and information. This typically relates to a patient's ability to take medications properly, to understand and use the information their provider is giving them, and to choose between two different insurance plans, and basically to make the best or soundest decisions they can when it comes to their medical care. We found that patients who don't have the health literacy that they need underutilize medical care, don't search out the appropriate amount of preventive services that they need, have more hospitalizations, and overall their health is poor. Oftentimes, patients have no experience navigating the healthcare system, and they kind of get lost in the shuffle, maybe are too embarrassed to ask their doctor for help. And that's a lot of times where us as healthcare providers need to offer a hand and make sure that the individual or patient is able to navigate through things, offer assistance.
We felt the video just shown did an excellent job of illustrating both health literacy's application and impact in the delivery of healthcare. In the upcoming slides, we work to further explain and illustrate the importance of healthcare literacy. Health literacy is important because it affects people's ability to navigate the healthcare system, including locating providers and services and filling out forms, to share personal and health information with providers, to engage in self-care and chronic disease management, to adopt health-promoting behaviors such as exercising and eating a healthy diet. And health literacy also affects a patient's ability to act on health-related news and announcements. On the next slide, a healthcare practitioner will go into more detail about health literacy's importance.
Health literacy means different things to different people, and it's ironic that we use a term that people don't understand for a concept which is about what do people understand. So officially, health literacy is about people's ability to navigate the health system. It's not just about whether people can read and write relating to the information about their health, it's about that wider thing. To me, health literacy is about two things. It's about helping people to understand better information, but it's also about the information we give them, making it as accessible as possible. So I've talked about that as a two-way street. So if we're going to improve health literacy, we need to help people to understand better, but also the information we deliver to them has to be as useful as possible. And hopefully if we do those two things, we'll come together in the middle. A lot of it is about whether people can read and understand the information we give them, but it is wider than that, about whether they understand what's going on in how their health is treated. What's more important than people being able to understand what's going on with their health? Health is probably everybody's number one priority. And if we can give people information that helps them understand their health and the treatments they get, then, it's clearly important. We need to make sure people choose the right intervention for them, whether it be a medicine or a device or an operation. And then if they do decide it's right for them, then we need to make sure that they take part in that process so that it's safe and effective. So with a medicine, taking it at the right time, knowing if a side effect occurs and what to do about it, whether it affects another medicine, all these things are clearly important. And so, that's why I do what I do. Better health literacy benefits everybody because our priority should be the patients, and clearly patients will benefit from being able to understand what's going on with their health and with their medicines. But the people who fund health services, the more people understand, the more likely they are to do things which work. And so economically it makes sense. The people who make medicines then, they want their medicines to work as well as possible, and so if people know how to use them safely and effectively, then that's clearly a good thing. So there's nobody really that doesn't benefit from good health literacy. There's an assumption that all health professionals are highly literate and have got loads of time to look at information, and of course they haven't. They're highly literate, but they're very busy. And so we need to make the information we give to health professionals as easy to access and understand in the same way that we do for patients, and the principles are the same. Busy professionals want information that's easy to access, easy to understand, and where they can find what they want straight away.
As you saw in the video, health literacy is critically important and should be assigned this importance by both healthcare practitioners and patients, as this ability contributes to patient quality of care. Now we move on to detailing the factors that our group has identified that significantly affects one's ability to acquire, express, and access health literacy. As with any concept, there are many factors that contribute to the causation of health literacy and the receipt of health care. Our research has identified both individual and systemic factors. The individual factors are literacy skills, health knowledge, demographics and culture, and one's experience. The systemic factors are public health practice with the communication and dissemination of health information, the public health infrastructure, which delineates access to services and resources, and the public health workforce. All these factors work together within public health context to delineate one's health literacy. The next slide starts our look at individual factors. All individual factors play a role in health literacy, but we decided to place emphasis on culture and individual literacy. We felt that highlighting these factors highlights the most influential of the individual factors. Culture is defined as the integrated pattern of human behavior that includes thoughts, communications, actions, customs, beliefs, values, and institutions of a racial, ethnic, religious, or social group. Culture is extremely influential on the course and experience of one's life. This influence is not exclusive of health, as culture influences patients' locus of control, preferences, communication norms, and prioritization of needs. Culture also affects an individual's understanding of physical and mental illness and of the role of the individual, family, and community. Here are some examples of health approach differences that are delineated from one's culture. A patient may prefer listening to a male physician over a female physician. LEP, or limited proficiency patients, may have some reading and writing skills, but may have a cultural tradition of folk medicine, where information is conveyed orally. This creates a disadvantage for patients that are in the U.S. healthcare system. And many cultures emphasize politeness towards healthcare providers, who they perceive as authority figures, and may voice agreement and understanding whether or not they actually agree or understand. We wanted to highlight that cultural differences are not limited to cultures from countries outside of the United States. Culture differences exist within American culture, as there are numerous subculture populations here. Culturally based health values, beliefs, and preferences of native-born patients may differ from the majority. For example, the African American population. Culture can influence the spoken and written vernacular language for native-born patients. This includes their vocabulary, grammar, pronunciation, and accents. Native-born minority patients may have less experience with healthcare because historically, healthcare opportunities may have been unavailable. Their experience with discrimination in healthcare feeds their mistrust and sometimes keeps native-born patients from seeking healthcare altogether.
Good evening, I'm Dr. Thaddeus John Bell. The title of this health tip is When the Information is Not True. Several years ago, a patient gave me this bottle. And on this bottle it says, Dr. Bell's Pine Tar and Honey, a prescription for coughs and colds. I kept it because at some point in time I thought I very well may be able to use it. And surely enough, the time has come to use this bottle as an illustration as to what I'm trying to talk about today. Over the past several months, there have been in our community in Charleston, South Carolina, a lot of information given on the radio encouraging African Americans to buy this product, to buy that product. The products either help improve your prostate health, help improve your energy level. Just this morning I heard a commercial about a product that will help improve your hair and make your hair grow longer. Many of these ads, most of these ads, if you will, are just not true. It is very interesting that the federal government is beginning to investigate a lot of these ads because they seem to be targeting African Americans as well as other minorities, trying to get them to get involved in buying these products. Here are a few tips that you would want to use going forward. Most of the time, there are no products that can improve your health that are not given by physicians or given by a prescription. Even when you hear of a product like an herbal product, always check with your doctor to make sure that that herbal product does not react in a negative way with medications that you are already taking. Most of the time, these products will say to you and use buzzwords such as, it has been clinically approved, or doctors recommend. Those are just buzzwords. They are words that are used to encourage you to call a number and get a free sample for 1 year, and these products often do not work. The bottom line to all of this is, don't be a sucker for this. Don't be a sucker for this. Oftentimes these products do not work, and very often they can kill you. Always check with your healthcare provider if you are not sure. I'm Dr. Thaddeus John Bell, and I hope you don't end up buying Dr. Bell's portion, closing the gap in health disparities for African Americans and for the underserved.
Now we move to qualified language and its proficiency effect on health literacy. But first, let's define language. Language, according to Random House's dictionary, is a body of words and the systems for their use common to a people who are of the same community or nation, the same geographical area, or the same cultural tradition. As with the expansive reach one's culture has on an individual's life, the same is true for one's handle on language. The American healthcare system utilizes English. Limited English proficiency significantly affects health literacy. Limited English proficiency restricts the ability to read, speak, write, or understand English by patients. This is further illustrated in the following video.
Extended care, first floor. Okay, Don,
Yeah.
it's the language line to translate.
Oh, Jesus, thank God. Okay, when can they come down?
All right. Oh. They said they can't send someone until tomorrow.
This cannot wait. We need to take care of this right now. Do not let them off the phone. See if maybe we can just tell them what she's saying, and then they can translate it for us.
We're gonna try to tell you what she's saying. Okay.
Mahoba chinyam.
Mahoba Chinyam.
Mama hoba chinyam.
Mama Hoba Chinyam. He says that doesn't mean anything.
Chum chinyakin. Chum chimyakin.
Chum chim yakin.
You gotta go up. Nyakin.
Chum chim yakin. He said that doesn't mean anything either.
ញ៉ាំមិនបានសោះខ្ញុំញ៉ាំអត់បានម្ហូបនេះខ្ញុំញ៉ាំអត់កើតខ្ញុំអត់ចូលចិត្តម្ហូបដឹងទេខ្ញុំអត់ចូលចិត្តម្ហូបដឹងទេម្ហូបនេះអត់ឆ្ងាញ់ខ្ញុំអត់ចង់បានម្ហូបនេះខ្ញុំអត់ចង់នៅទៀតនេះទីនេះទៅខ្ញុំទ្រាំមិនបាន
ខ្ញុំមកឆាយទ្រាំមានបាញ់ខ្ញុំមកឆាយទ្រាំមានបាញ់
Show me chai, crawl me by.
ទ្រាំមកផាញ់ខ្ញុំមានចាន់
Show me chai.
ទ្រាំមកផាញ់ខ្ញុំមានចាញ់
Rumbum chai, Chucky
ទ្រាំ
chai.
មកឆាយក៏មានបាញ់
Pull me by. He says that doesn't mean anything either.
Okay, you know what? Put it on speakerphone. Put it on speakerphone, and then they can hear her directly. I think
Hold on
that's.
one second. How do I do that?
Press hold and then intercom and then line.
Well, hold what then what?
Whatever line. Just
Right, but how
pick a
do I
line.
know which line?
Because it's blinking. You'll see it blinking.
What
and
blink?
It's flashing in front of you, Denise. Can you see it flashing?
The whole phone is flashing. I don't know how to work this
just,
old
you know what?
ass
Hold it up.
phone.
Hold the phone up. Hold it out as far as you can, and then they'll hear what she's saying. And tell them it's something Chinese. We think it's something Chinese.
សម្រាប់ខ្ញុំទៅខ្ញុំទ្រាំអត់បានទេខ្ញុំសម្រុំមិនបានទេខ្ញុំចង់តែស្លាប់
That's a good one.
ខ្ញុំចង់តែស្លាប់
That's gotta be something.
Did you get that?
ខ្ញុំចង់តែស្លាប់
Good.
សម្រាប់ខ្ញុំទៅ
He says, she says, I can't stand this. I wish I was dead. Please kill me. It's Khmer. She's Cambodian.
Cambodian. I knew it was something like that.
Research shows that minorities are more than likely to have limited language proficiency as compared to the majority. Average literacy scores for Blacks, Hispanics, American Indian and Alaskan Natives, and multicultural adults were lower than those of white and Asian Pacific Islander adults. 58% of Blacks are illiterate, 66% of Hispanics are illiterate, as compared to 28% of the white majority experiencing illiteracy. One's handle on language or their language proficiency is not the only factor that affects health literacy. The way in which one expresses themselves does also. Communication skills play a role in a person's health literacy. When thinking of health literacy, patients need to be able to read health material such as discharge papers, insurance statements, medical bills, consent forms, and health education material. Writing skills are needed to complete enrollment forms, living wills, and insurance claims. Now let's move to the other category of factors affecting health literacy that were presented in this section's introductory slide. As one would want to believe that the individual is solely accountable for their health literacy, the opposite is true. There are systemic factors that amplify individual deficiencies, contribute to health illiteracy, or stunt health literacy altogether. Given with the current healthcare system in place, there are certain populations that are at risk. The National Center for Education Statistics tells us that limited health literacy disproportionately affects populations that are underserved and at risk for certain health problems. The following chart indicates the characteristics of adults with below basic health literacy. We will provide you a moment to review the chart. Now we will move on to understanding other factors that contribute to the current systemic issue. People living in lower income neighborhoods are disproportionately affected versus higher income communities. Contributing factors are on 3 levels: the individual with their education level, health literacy, and healthcare access. 2, their neighborhood, involving factors such as crime rate, violence rate, and social order. And 3, social determinants, an individual's social support, their social networks, and their social capital. We reviewed systemic contributors to one's health illiteracy. Now we'll move to qualify the ways in which public health care affects health literacy. Public health has the broad responsibility to protect and promote health in all its dimensions. To fulfill this responsibility, a public health agency's mission must be sufficiently broad to address the full range of factors that contribute to health and health disparities in various populations and their many subgroups. The public health agency must not only understand how to produce health and prevent disease and injury, but also capitalize on multiple targets of opportunity to advance health. It works to protect the entire population from health threats such as communicable diseases, foodborne diseases, natural and man-made disasters, toxic exposures, and preventable illness and injury. On parallel tracks, its goals are to prevent both the occurrence and progression of chronic diseases such as heart disease, cancer, and diabetes, which collectively comprise over 70% of the burden of ill health. Minimizing chronic diseases requires intervention to reduce contributing risk factors and individual behaviors. These can include poor nutrition, inadequate physical activity, tobacco use, and the use and abuse of other legal and illegal drugs. However, to achieve significant improvements, the underlying determinants of our collective health burden must be addressed with equal vigor. These include the underlying physical, social, and economic environments. As stated by the Institute of Medicine, public health is what we, as a society, do collectively to assure the conditions for people to be healthy. We felt that discussing public health infrastructure will supplement your understanding, as the infrastructure is the backbone or support of how healthcare is delivered. Infrastructures are the basic services or social capital of a country or part of it, which make economic and social activities possible. In terms of public health, they are the formal and enduring structures that support public health, having both tangible and intangible aspects and existing inside and outside the government sector. They may be directly protective of health, as in public sanitation systems, or they may support other activities that protect and enhance health. The elements of public health infrastructure that tend to be easiest to recognize and to describe are those concerned with areas such as communicable disease control, including the safety of food, the protection of the health of mothers and children, and the control of environmental contamination. Less easy to identify are those infrastructures related to the control of non-communicable disease and injury. However, in all these cases, effective improvements in public health require the three elements: institutions and capacity appropriate to respond to these problems and associated tasks, given the needs and circumstances of the country involved, knowledge as assimilated and put to use both by the general population and by professional and administrative staff, and 3, necessary commodities, resources, or tangible infrastructure. Last but certainly not least, and worth of discussing, is the public health workforce. The people, or human capital, of the public health system definitely factor in the delivery of care, which consequently affects health literacy of patients included. The people. Workers are defined by formal educational attainment and in some cases a state-issued license to practice. The work setting. Essential services of public health, the main criteria for defining public health work, are performed in governmental public health agencies and in private sector settings such as hospitals and community agencies. The challenge. There has not been a national system of public health workforce studies for at least 20 years, yet other national policies have a large impact on the workforce. There are no long-term recruitment and education strategies to fill the workforce pipeline, even under routine conditions. Important to our group was not only to research contributing factors to health literacy or qualifying health literacy, but was to also research and identify ways to improve health literacy. We've come up with the following calls to action. First, there needs to be an increase in the opportunities for access. Second, there needs to be an adjustment in the delivery and account for different levels of understanding. And third, there needs to be a higher placement of importance on health literacy. In the next few slides, we will delineate the action items and next steps that we have identified in meeting the 3 calls to action. In meeting number 1, increasing access opportunities, health literacy courses should be offered in a variety of spaces and contexts. This could include high school life skills and health courses, doctor's office and health clinics, and local community colleges and training academies. Adult learning complexes affect the level of comprehension. Therefore, adjustments should be made to better understand the material. The following, we believe, will help in reaching call to action number 2, adjusting the delivery and accounting for different levels of understanding. First, online resources should be easy to navigate. They should be accessible on more than one medium with ease of use. Live trainings and courses should explain health literacy in simple and coherent terms. There should be a check for understanding following the courses to evaluate the level of learning. And third, resources should be offered in multiple languages. The U.S. is very diverse, so offering health information in many languages will be beneficial, but it is often overlooked. Last, and fulfilling call to action number 3, which is placing a higher level of importance on health literacy, we recommend making health literacy courses a requirement for government assistance recipients and providing courses in professional settings such as workplaces and college institutions. We, Group A, Hope that you've enjoyed our presentation and that your knowledge of health literature has been advanced with the information presented. Thank you.